Ambulance service. Is the patient breathing?
We're back on the front line.
West up, better mobilise.
Following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby? I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they were going in with shields.
We're expected to dip into everything: mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine, you're fine.
Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time, we're with crews in Glasgow, Inverness, and Linwood.
West up, prepare to mobilise. RTC, Airbles Road, Motherwell. 4 vehicles, persons trapped, and also police vehicles are involved in the incident. Talk group 43, please. All vehicles attending. Thank you.
SORT paramedics attend some of the most dangerous incidents across Scotland.
There has been certain times within my SORT career when you pick up the phone and you know, you sort of get a feeling and you say to yourself, this is not the kind of job we usually attend.
Mate, I'm in the extend. Does it sound bad?
There's police vehicles involved. I don't know how bad it is, to be honest. Right. There were different reports coming in. We had reports that it was 2, 3, 4 motors that had been involved in the RTC, and we were told it was maybe high speed as well. Hopefully we'll get a sit rep on the talk group prior to us getting to the scene of the incident. Well, it's a multi-vehicle accident, and it seems as if it's high velocity as well, which can obviously cause severe problems. It always gives your heart a wee sort of flutter when you do get these calls in, when it does involve your emergency colleagues. The thing that's going through my head as well is, on a personal note, is that I do have family members that are based out that way, that are police officers. So hopefully it's there's nobody involved that I know. I've been sent to instances before where there has been persons that I know and members of their family. So it's always a wee bit of a worry when you do get that first call through and then your mind starts racing a wee bit. SORT team leader receiving.
It's been a 2-car RTC police vehicle head-on into another car. Don't know how many casualties it has yet, so things will just continue until we know.
That's perfect, mate.
The SORT team will help coordinate the ambulance crews that are already on scene, but they need to get there first.
If you're on a journey like this, which is maybe, I don't know, would it be 30 mile? 30 mile, and every mile along the road you get delayed, then it all sort of adds up. There could be an intervention that we have to perform that might maybe be able to save somebody's life, and we're stuck in traffic. But you can see the challenges we've got already. Every second counts. They're letting us through, that's good.
Slalom.
Slalom it is. We'll get parked up and we'll see what we've got. It's obviously caused a lot of concern for everybody. In any road accident, the faster you're going, the more likely it is that the injuries caused are going to be severe. Road accidents involving emergency services don't happen that often, thankfully. But they do happen.
But yeah.
When you arrive on scene, it does look very chaotic. I try to walk through the incident to see where the patients are, what's involved. Not to make any rash decisions, not to rush in. And I think that's where the SOT training comes in as well. Get a good brief from whoever's there, and I can make decisions from there.
Right, Gaffer. These two guys here are going to need an assessment. Right. So, the guy with the glasses, he's been in the vehicle, he's went head on with the police car. Okay. Boy in the shorts is really the focus, he needs an assessment, he's got abdominal pain. Okay. He's took the least of the impact.
Sure, do you want to have a wee look at him then?
And then the boy with the shorts on is the abdominal pain. I've not got a motor for him to move.
Several people are injured, including 2 police officers. It's Stevie's job to ensure the most serious injuries are treated first.
Matt, do you want to take him down here, us? This young gentleman here. You be all right, pal? You're fine for you?
Oh, Kilmer. To be honest, I'm probably landed a wee star.
I know, but listen, Stuart's going to take a look at the other guy. Right. Do you want to go with Matt? Pete, do you want to go with Stuart? Is that all right, mate? Aye. Take him down a bit of that. Even use my motor if you want, Matt, okay? It is hard. Sometimes when you get to the scene, try to work out what's happened. But it's not really my job to work out, it's more my concern is what patients need treatment and in what order, really. Hey, Arth. How you doing, all right? So we can put some in here if we need to.
Yes, of course, right.
The police, the 2 police officers were pretty shook up. You've got to remember, these police officers arrived to an exceptionally high standard. So for them to be involved in an incident, it's very unusual, if I'm honest.
One of the drivers has a pain in his chest.
I feel like it's getting serious by the minute. I don't think that's it. Yeah. All right? Right, come on, I'll do an ECG. I'll be there as well.
Feel okay, but?
Aye, just a bit sore across your abdominal area, but
not
too bad.
Yeah,
all these ups are fine.
Fantastic.
You're a happy man at the weekend there?
Aye, mate, it was good. It was a hard watch, man. Honestly, it wasn't good for the heart to make this ECG.
You can have been that on Saturday.
Aye.
You broke one machine.
Aye.
I think over my career in the ambulance service, attending road accidents for the past 30 years, the way cars are now built is exceptional. They have crumple zones, airbags. They're absolutely fantastically built. Whereas years ago, any kind of slight bump and it would sometimes have fatal consequences. But in this particular case, there was nothing there and they were all sort of minor injuries, although they were very, very shook up. Right, that's us. Good to go. Good to go.
To drive properly.
What do you think I feel? I can't. Stop.
Before joining the ambulance service, Just prior to the pandemic, I was an outdoor instructor, so I used to teach people to kayak, canoe, mountain bike at an outdoor centre. We had a paramedic who came and did some freelance work with us at the kind of last centre I was at. Kind of got chatting away to her and thought maybe that's something that I might look into doing. I and kind of enjoyed that sort of stuff. Took about a year to get in, but eventually got in and then joined the week before the first lockdown.
Me and Kyle were friends long before we were crewmates. We worked together there for 4 or 5 months, and to be honest, it was a joy every day you come into work. We have a good relationship.
We're going to come.
So, I think we're going to a 73-year-old male. There's a lot of stuff in that. Speech problems with sudden loss of mobility. He had a previous stroke at some point 5 or 6 months ago. There's 2 types of strokes that you can have. You can either have a hemorrhagic stroke, so a bleed, or you can have an ischemic stroke, which is a kind of blockage of the artery.
Okay, have you got the oxygen? I've got it. Yeah?
So that kind of time frame for when that happens is more risk for damage to the cells, because the cells are not getting oxygen, so therefore they're starting to die within the brain. The faster you get there, the faster you get treatment, the more of the brain you can save.
Mrs. Fraser, how are you? You all right? Oh, it's all go in this house.
I know, I've been my son lately.
What's been happening with you then?
I don't know. It's all right.
Is this just quite suddenly then, or has it been an ongoing issue, or has it just happened just now, or how long's it been?
Alone.
Just last night? You're not getting away. Mrs. Fraser, are you still there?
Yes, I'm here.
So, are you able to tell us in your own words what's been happening to your husband?
This morning,
Listen, you're okay. You're all right. Listen, guys.
After him, all right.
You're safe hands, all right? Don't worry about nothing. All right.
Oh. I got a wee chat, Kyle. Yeah, no probs.
All right. The patient's wife was quite upset. It's quite a distressing situation for anyone to be in if the family members developing stroke-like symptoms. We like a divide and conquer kind of attitude. One of us will be kind of dealing with the patient, another person will be kind of dealing with the family members to try and calm the situation down and kind of gather any more kind of information that might help us kind of ascertain what's happening with this patient at that time.
This ever happened before?
I went into hospital 6 months ago and he had a urine infection. But there was something bubbles in his brain burst.
Right, okay.
It's not really been right since it. And it was great up to,
3 months ago.
great going to football, going for a pint. And the last 5, 6 months, it's just, it's went really downhill.
They never said stroke to you or bleeding the brain,
nothing,
nothing like that?
No.
Okay.
And his walking's no great.
No great.
Okay.
It's just when I was talking.
Yeah.
This gentleman had what we think is a TIA, kind of mini stroke, in September, October 2022. And I think the fact he's now got similar symptoms to today's episode, I think they know what's coming. I think they know what's happening, and I think that's why he got upset.
See the way you're presenting today? Was it exactly the same as when you went into hospital the last time?
Paramedics can spot symptoms of a stroke by using a series of observations, usually referred to as a FAST test.
F stands for face, so does the patient have a symmetrical face? Do they have a facial droop? Can you give me a big smile? Ideal. Ask the patient to smile because it's a really good way of seeing whether somebody has a facial droop, because if you try to smile, one side of your face won't be able to do it. A stands for arms, so has the patient got any weakness in their arms, whether it's their inability to kind of hold their arms up. S is for speech, so does the patient have any anomalies with their speech that's out with their kind of norm? And then T is for time, so is that kind of time critical element.
And you think your mobility is not as good, is that fair to say as well? Your balance, coordination, is that?
I think your mobility is not as good, is that fair to say as well? Your balance, coordination, is that? Your balance, coordination, is that? So the kind of main two things for you is the speech, getting your words out, and your kind of balance, coordination. Yeah. Okie doke. After our assessment of Tommy, it was clear the patient was FAST positive. He had slurred speech and dysphasia. Dysphasia is where you know what you want to say, but you struggle to get the words out. What we'd like to do is take you up to the hospital. Are you happy with that? All right. Some view out there, aren't you? Nice. You got your hand up, my friend. Come on up. But I promise we've got you. No drop to end of the day. Balance coordination issues is also a symptom of a stroke. Although he didn't have any weakness in any particular side, he still has symptoms of a stroke, and they were still active.
In hospital, Tommy will have extensive tests, which will give a more detailed picture of what has happened.
We want to get to the hospital rapidly. And the reason for that is that they could potentially get a scan to then theoretically get blood thinner to dislodge a clot.
But you'd get paid for this.
Nah. You want me to make a break for it? I'm only kidding, I'm only kidding.
I know you're only kidding.
Coming, my wife wouldn't come with me, I'll tell you that now.
Pete's always able to get a patient on board with him. He's got a great demeanour with patients and easily makes a good rapport with them.
Listen, there's a panic button down there if you get sick of listening to him, all right? And I'll pull over, all right?
Learning little kind of bits and tricks that he uses has been key for me in becoming a paramedic. Pete's one of those people that, like me, wants to see the job done and done well. It was a really good 4 or 5 months for me. Genuinely could not have wished for another paramedic to be on with other than Pete.
Listen, why are you getting emotional, okay? Come on. All right, gang, how we doing? All right. Take my bag. Hold on a minute, that's not my colour. Hold on. There we go. All right.
Kyle.
So I'm Pete, that's Kyle.
That's right, you remember the good one, Kyle.
That's a nice family, wasn't it?
They were really nice.
I wonder what's going on.
That's some shirt.
That's some shirt, he's rocking it though.
Yes, yes, rocking.
It's a nice day, isn't it?
It's a cracker.
Okay, so your condition's got worse since the last call was made, is that correct? Right.
Call handler Pam is dealing with a young, panicked patient. This is the second call this patient has made today.
Right. Okay, so how old are you? You're 16, okay. She came on the phone saying that, I think I'm going to die, you need to help me now. She felt like that her heart was racing, that she was maybe having a heart attack. Right, okay, you just listen to me. This time I'm going to stay on the line with you, okay, until the ambulance is right there. But I do need to ask you some things as well, okay? Do you have difficulty breathing or swallowing? You do both of that, okay. And have you ever had a severe allergic reaction to the same or similar thing before? Okay, okay. And do you have any specific injections or other medicines to treat this type of reaction? You don't, okay. If it is the same caller that's called the second time round, the condition has changed, so we go through the call again. So then the call is reassessed again, and if it's appropriate, then it would be upgraded to a higher response. That's not always what happens, but in this case it was. Okay. Right, okay, so I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next. Right, okay, so you just continue to focus on your breathing, take slow, deep breaths, okay? And I'm going to stay on the line with you until they're there, okay? Okay, listen, I can't give you an exact time, but I can assure you that the quickest ambulance is coming to you. Okay, it's a high response ambulance you're getting, and we are coming to you as quickly as we can, okay? We just cannot tell any caller that calls that the ambulance is on the way, because an ambulance could be allocated, but then there could be a cardiac arrest in the same area, which then those crews would then be diverted to that because it's a higher priority response. No, I'm going to stay right here with you until they're there, okay? You're doing really well. I know, I understand. It must be very frightening for you. Okay. You just take slow, deep breaths, okay? If you raise your voice, that's going to panic somebody even more. So we use a skill which they call repetitive persistence, which means that we talk in the same tone and sometimes having to repeat things over. It does take a little bit to learn it to start with, but it's a skill that does work. And I know how frightening it must be for you, but try your best to just take slow, deep breaths in and out. You're doing really well though. Well done. Okay, you just stay awake, okay? You can keep speaking to me. No, you just stay sitting down. You said that you're feeling faint, okay? So just sit down, okay? Okay. There's a protocol that we follow which means that it does become our highest response ambulance, a purple response, which would have been sent to her. So I just stayed on the call with her until I could hear the ambulance crew there with her taking over. Oh, that's great. Okay, I'll just stay on the phone with you until they're right beside you though, okay? Are they in the house with you now? Okay. Right, that's fine. I'll leave you with the crew then, okay? You take care. Okay, bye now. Bye. It's just such a rewarding job. I know that it can be stressful at times, but it's very rewarding. Yeah, it's something that I just love doing, and I just love the job as an emergency call handler.
So basically, vascular dementia, poor mobility, falling. God, he's got loads wrong with him, you know?
Can be one of those, like...
Hold on,
difficult to... You say Gallagher?
Yeah.
It's nearly the end of Pete and Kyle's shift, and they are attending an 86-year-old man who has fallen.
He's actually fell twice today. He's got vascular dementia, he's got poor mobility, but I think they're querying whether he has a kind of chest infection. It's just kind of general deterioration. I don't think he's very alert at this moment in time, very sleepy. That's all we've got, I'm afraid.
It's potentially difficult to assess him given his vascular dementia, but we'll just need to see when we get there. So if you want, when you go in, I'll get a set of obs and maybe just start asking the patient a few questions and stuff. You get a story from a bystander, family member who's with him. What are you looking at for?
You want to take over?
I don't want to take over, I just thought this was about a partnership rather than a dictatorship, but you know.
Yeah, it's going to be...
No, you've ruined it now.
No, I was thinking about what you were saying.
No, it's fine. No, it's fine.
Do you know what I think you should concentrate on is your driving, mate? That's what I think.
I'm trying.
Is this us? Hiya, how you doing? I'm Pete.
We walked into this patient's house and there was multiple family members in this house. I think there was about 4 or 5 people in the house. Yeah, and the patient was lying in a kind of a wee extension at the back of the house on the floor, and a bit of a heap lying on shoes and kind of a few other things that he'd managed to knock over as he went down.
Bennett, are you sore anywhere? See where I'm touching? Like just where I'm touching you. Any pain in your neck?
No.
Okie doke.
Patient's family are obviously a little bit upset about what's going on and just kind of looking to us for kind of a bit of help and guidance.
Yeah, see, once we've assessed you, we're going to get you off the floor soon as, all right?
Pete.
It was a bit of a shame because he'd actually waited an hour and a half for an ambulance. So he's been in the floor that whole time, he's uncomfortable. And actually now he's got a long lie. So even if we don't find any injuries, a long lie can affect your kidneys, cause a lot of abnormalities with the bloods. Sorry, Ben.
Okay.
I'm just trying to get a wee story from your daughter there. All right, my friend. How bad is it, the dementia? Is it really bad?
Just the short term. Short term.
Nonsense. Well, a funny age, that's all it is.
Now, me and Kyle, when we go to any job, it's important to establish, has the patient fallen or they collapsed? They're two very, very different things.
Did you witness this happening too? Right.
See, unless you're actually there, right beside it. You don't know whether you've got the right story or not, to be honest.
Okay. So a fall tends to be a patient who has tripped or slipped over something, and there's not been any obvious apparent medical reason for them to go down, but a collapse is a medical reason for somebody to go down. There could be a problem with their heart or their breathing, or any multitude of kind of medical complaints that are going on that can cause the body to decide that it's going to go to the ground at any moment.
All right, shall we get you up, my man?
1, 2, 3, let's go for a big stand up. And then we'll go into that chair there. Oh, that a bit better.
Magic.
Magic.
Right.
Catch your breath. I think fairly out of puff, so you do. We've got a couple more checks to do on you, Bennett, all right?
Yeah, I'm not going anywhere.
All right, no worries.
No plan.
No plans. He's got a lot of factors that are worrying signs, especially somebody who's had a query collapse, because we're not sure 100% around the details of what's happened with him.
So what is it you done for a living?
I was a policeman.
A police?
Another call sitting there.
Is that aye? No way.
That wee woman.
That's always a good story. How did you meet your husband? Well, I met him in the charge bar in Mill Street.
Is that right? No way.
She was CID, and I was a real cop.
Oh, it's all coming out now. Ben, we're going to give you a sweet inhaler, okay? It should help with your breathing a bit, sir, okay?
Just as well you're not a hairy man, because we'd be shaving you. You know. There you go. Right.
With any patient, we always try to give them the opportunity to decide what happens with their healthcare. Obviously, Bennett having vascular dementia reduces his ability to have capacity, and we need to aid him in that. But given his kind of comorbidities that he has, he's had a triple bypass, he's got high cholesterol and irregular heart rate as well.
You're like a new man, actually. Do you know, your breathing rate's going right down. So, amazing what a bit of the good stuff does for you, innit?
In our kind of minds, we want to take this patient to hospital, and we will kind of advocate for that point of view.
We've had a good assessment of him. When he's fallen, head, back, hips, there doesn't appear to be any obvious injury. So we kind of got away with that one there, Ben, all right? So, but his breathing rate is increased. You can hear him puffing away. But see what you're saying. I think it's potentially a chest infection, because asking a couple of days, increased shortness of breath. But you yourself said you're kind of weak, tired, you know, had a couple of falls.
A lot. Yeah, you have been sleeping a lot.
So I wonder if there's potentially a kind of chest infection brewing. One thing I'd like to do with you, with your permission, is take you to the hospital just for kind of further assessment.
Today I'm feeling fine. That's how I look at it. My wife and my son, they probably see wee differences I don't realise. Funny thing. I'm getting old, right?
Aren't we all? Aren't we all? All right. Are you happy with that? Are you happy with that?
Yeah, I'm very happy with it, because I really was frightened it was going to happen again.
Yeah, I think that would be our concern. Let's make an escape, will we? Sound quite chesty, doesn't it? Like, I don't know if it's
He's still coughing a wee bit. Yeah. So, talk to that. You done that right on cue there. You went to do it.
Right, we'll see you up there.
Okay.
See you up there.
Hi, Dad.
Is this his pills?
Bye, Darren.
Yes. You want to take a tea box, actually?
Do you like that? I just need a tea box.
I'm not allowed to have anything to do.
We'll take good care of your man.
Okay.
There we go.
I think it was the right decision for him. I think there's a lot of things going on. Bennett himself wasn't adverse to going to hospital. I think he was happy that that was kind of the right decision as well. All right, champ, how's it going?
All right, yeah, good. Oh, it's been a long day, but a good day.
It has been a long day, but a good day.
No, it's been good. You know what? And I think, see, when you finish on a high. Yeah, that's a lovely, lovely family there.
I know, it's really nice, just...
Lovely couple, so, do you know what? It kind of makes it all worthwhile, right?
It certainly does.
Kyle, there's no better person I'd rather spend 12 hours with. I mean, every word of that.
It can make or break your week, definitely, who you're on with, so...
Yeah, but, you know, never. Tomorrow you might break me, who knows, you know?
Yeah, well, I'm in the bag, so it's... you could just drive, that's all I need.
I think certainly in the west coast of Scotland there seems to be a huge influx of water incidents, whether that be for sports or recreation or just by accident. Certainly West Sort, we seem to get a lot of water incidents over the summer period, which is quite noticeable.
So what's the story?
So in Dumbarton, 2 patients have been in the water for 60 minutes. They believe that they're now on shore, although they don't know where they are. So ourselves, the water rescue motor from here is going, the lifeboat, Coast Guard and divisional crews are currently heading to the locus at the moment. So let's go and see if they need any assistance.
So were they in the estuary, were they?
Sorry?
Were they in the estuary?
The estuary. It's a big word.
Just to advise, the locus is floating accidentally in accordance with the what he wants.
Sort to be acknowledged. So apparently they're on the shore, although we don't know what condition they're in.
Were they in the water for 60 minutes out of choice?
I don't think so, no, the boats, something wrong with the boat.
Ah, they were in a boat. I imagine you'd be quite cold if you'd been in the water for 60 minutes.
Definitely.
But there's another problem. There's a railway line between the crew and their patients on the shore.
West Armstrong units are in the shore, but it's just to give you an update that we are currently on the phone to Network Rail until the train is stopped, but apparently the line is still live at the moment. They're going to advise us as soon as it's been turned off.
See, there's the trains here.
Yeah.
Cops are there. There, see there, Chris Coast Guard.
Yeah.
Yeah, we have just arrived at scene. Could you replot all vehicles to this locus, please? Over. James, I'm just going to jump down and see what's happening, mate, and I'll give you a wee shout.
Yeah, no worries.
As we could approach, we could see the train had stopped, although we need to make sure that the railway line's closed to be able to cross it safely because there's a train coming the other way.
And how you doing, all right? How's things? Are they still on the shore side?
Yeah, they're at the far side of the railway. So
Are you guys with them just now?
Helicopters on scene.
Right.
Paramedics out from the helicopter.
Okay.
I'm not really sure
Right.
what condition they're in.
Okay.
All I know is one is hypothermic. That's all I know at this time.
Okay.
Still possibility of one outstanding.
Right, so possibility?
Possibility,
Okay.
but third still outstanding.
Okay.
The Network Rail have advised that the line is blocked between Cardoss Station and Dalby.
The line's okay to cross now, right?
Do not go towards the Halers side.
That's all received, Jim. If you just grab your response kit, please, and just make your way down to the train. Hello. Hello, how are we?
This is Hugh. He's been in the water for a good period of time, probably in excess of an hour. He's managed to get himself to this point. His mate is down on the beach, our paramedics down with him at the minute.
Hugh and his friend were fishing on the River Clyde when their boat capsized. They were spotted by the driver of a passing train who raised the alarm.
I'll just put this on you just now, bud, all right? Let's get you warmish.
Type 2 diabetic. He's had a little bit of a kind of nutty bar. He doesn't feel any, he doesn't feel, he had a life jacket on, but he reckons he's taking a lot of it off.
Okay. And other patient?
He's being stretchered at the minute, so he's been immobilised, placed on our stretcher. He will be flown to QE. We'll go direct to QE.
And who's he?
He's the man who went in fishing all out the water.
Right.
As well as the eagle-eyed train driver, the patients have been helped out of the water by a passerby.
And there's a fully 2 patient. Just 2. He was the 3rd. He's the one that's been in an extraction. Okay.
I assessed the patient with one of my colleagues, and all his observations were within normal ranges. He seemed just a little bit shaken up from the shock of going into the water and struggling for a prolonged period of time. But he didn't have any red flags.
One patient has been airlifted to hospital. Hugh, however, will be taking the low road.
Train driver saying we could get him on the train and take him to Cadros.
I need everybody clear of the line before I go to station.
The only way of taking that patient out of there safely would have crossed the railway line, crossed all the fences that got barbed wire and muddy fields. So that would have taken one time and put staff at risk and possibly the patient at risk. So we decided that because the train was there conveniently, that we would put the patient in the train and take the patient to the train station where they would meet by a divisional ambulance crew.
We do go to a lot of jobs where the patient's actually been in the water and under the water and they're actually in cardiac arrest. So this was actually a pretty good outcome for us. Because there have been a lot of fatalities in water in this area, especially in the last couple of years. It's quite funny. We may take your baggage, but we will never take your freedom.
Do you want to try that in a Scottish accent?
Might be construed as racist.
All right. Nah.
We may take your baggage, but we will never take your freedom. My missus says I've got a terrible Scottish accent.
She's not that wrong.
Can't be any worse than Mel Gibson's Scottish accent anyway, can it?
Right, what's your prediction?
I'm going to say seizure somewhere far away.
Seizure far away?
In a land far, far away.
I'm going to say fall in Kirkintilloch or Lindsay. You ready?
Go for it. Nice and
G73 here we come.
positive vibes.
And don't need to think.
That'll do.
Shelveston Road. Definitely. Okay, so we're off to a 62-year-old female who has a strangulated hernia, episodes of vomiting, feverish and abdominal pain, and we're probably about 5 minutes away. The East End of Glasgow is a great area in Glasgow to work in. There's always lots of stuff going on, lots of different types of people we deal with every day. There is definitely some areas where there's a bit of deprivation and such. What I really like about East End is there is a strong community spirit. The amount of times we go to jobs and it's only the patient's neighbour who's been keeping an eye on them for days and weeks, and you know, they wait with them till the ambulance gets there. So, you know, it's a great area of Glasgow to work in.
Oh, hello there. What's been happening, my dear?
Yeah, I get hernias that split between the big bowel and the wee bowel.
Right, okay. Right, and what's been happening today or tonight, should I say?
I can't swallow, can't eat anything, nothing.
Are you vomiting after? That's since yesterday? Right, okay.
A strangulated hernia is the sort of the vein network sort of constricts around it, cutting off blood supply to that sort of specific area, which can be very painful, very serious.
Okay.
Anne has been suffering from hernia problems for several years.
Right, okay, though. You just feel as if you've been totally unable to eat.
I used to have this every Tuesday one.
Right.
And I've not had it, I think, till last November or something.
Right. And what was the treatment for that when you had it the last time, usually?
I really needed treatment if I was so long with.
Right. And what do you know what they done there? Like,
Put me in a drip.
Right. So, see this pain? Show me exactly where the pain is just now.
There.
Right.
More than it goes to there.
It's a low.
Yeah, pop that off your finger just now.
Up to here.
Right, okay, okay. How normal, or does it feel anymore?
Really hard.
Right, okay.
Normally it feels numb.
Right. Can I have a wee palpate? That's what I feel if it's cold or anything, alright? So that's... so it's definitely quite hard. It's not normally as firm as that?
No.
Right, okay, okay. That's fine.
She was reporting this was quite a different presentation for her, and that she's had issues with this in the past and it feels similar. But also some of the kind of history that she was telling us and some of the things we were finding when we were examining her were either making it difficult to fully examine her or kind of adding to the bigger picture that actually this needs more investigation than we can do kind of in the community at our house. And what does the pain feel like?
Sometimes it can feel like it's someone stabbing a knife up. Like, or other times it can feel like ringing.
Twist, like kind of twisting. Okay. Right, okay.
She was a very direct lady, and just by the way she was behaving, the way she was acting, the fact she called an ambulance for this means that, you know, she was really struggling with it. And, you know, maybe even a bit worried about it. And it was causing a lot of pain.
So what we could do is we could give you a jag with some anti-sickness. We could give it a bit of time to work, and then we could try you with a wee bit of paracetamol and see if you can keep that down and see if we can get your pain a wee bit better. How does that sound? Okay, so a sharp scratch. From our perspective, there's nothing that we can really do. It's mostly around pain relief and symptom management, and then straight into the most appropriate area to resolve that. So ideally it'd be the surgical assessment areas or into A&E, because really the only way to resolve that's with quite intensive medical treatment or potentially surgery.
So a wee trip to the Royal, are you okay with that? We'll get all this under control. There's no rush. We're going to go and get our stuff back in the ambulance and we'll work out the easiest way to get you out, okay? We'll be back, all right?
Anne is classed as bariatric, meaning she needs specialist care when being transported.
Patients of sort of bariatric nature can present difficulties just in terms of moving them safely. Even something as simple as lying flat on the back can compromise the airway quite quickly. Getting them on a stretcher, lifting from the ground, you know, all these things do present, you know, a bit of a risk to the patient and also to the crew who's moving.
If you're here now, well, that makes life even easier.
Some woman.
Oh, I knew it was like carrying coffins at that time. Oh, don't. Well, I've been in that for 15 years and I've been 50 coffins to put up.
Well, that's no suspicious at all, is it? The dream patient, Mrs. Honestly.
Cheltenham's a nice place.
Look, we love Cheltenham.
But she just kind of appeared at the door, standing, supporting her own weight. We didn't physically have to do a lot of lifting and manual handling, and she was quite comfortable.
Age, we sitting on top of you.
He is.
What age do you think?
I was 24, 25.
They're pretty close, eh? I'll give you that. It's actually my first day.
The night?
Aye.
Punch him. He's at the wind-up.
Oh, what you did? You're under my whole distance for anyway.
25. You're all right.
Well, a lot of this job is just communication. It's not about fancy technical skills or anything else. It's about being able to speak to people and usually have a bit of a laugh and get a little bit of a connection with people. You may only be with them for 5-10 minutes, but you're getting a very personal insight into their life. And it's equally helps you with the job because your crewmates need that as well. You know, we're stuck together for 12 hours. You need to be able to have a bit of a laugh, and otherwise it's a very long shift. I can hear sirens. I bet you it's the fireys. I bet you the fire alarm's sweating off from the hospital.
Here come the drama, guys.
There's one sitting there. There's one coming from the left now. Oh, here are you.
Oh my God. This is in a big security truck in the middle. This is a Batman film. Oh no, oh, Karen. Oh.
It's like a wee rendezvous of blue lights going on here.
Friends! Emergency service friends.
Me not friends.
Are you with her at the moment? Is she responding normally? When did this happen?
Like many coal handlers, working for the ambulance service isn't Leona's first career.
I've only been a call handler for 2 years. Prior to that, I worked in the prison service for about 7 years. It's a completely different kettle of fish with a lot of similarities at the same time. No 2 days are the same. You never know what you're going to get on the day, and communication skills are so important in both jobs. The way you speak to people can have a massive outcome in how your day goes.
Today, Leona is taking a call from a woman whose mum has had an accident in her kitchen.
How far did she fall? What caused the fall? You say she slid, is that correct? Is it her lower leg or her upper leg that's injured?
The patient has fallen and impaled her leg on a sharp piece of metal, and she's bleeding.
Any type of call where there's any indication where there's serious bleeding that isn't being controlled, we would give instructions to the caller just to apply firm, steady pressure on the wound with a clean, dry cloth or towel. It's at her knee. Is it obviously bent out of shape? Is she still on the floor? I'm organising help for you now. Stay in the line, I'll tell you exactly what to do next. Don't move her unless she is in danger. Okay, I'm going to tell you how to stop the bleeding. Listen carefully to make sure we do it right. There's a crew being allocated. It helps stem any bleeding until the crew get there, which can obviously help stop the patient deteriorating with that loss of blood. Get a clean, dry cloth or towel. Tell me when you have it. So I want you to place it right on the wound and press down firmly. Don't lift it up to look. Without lifting that cloth or towel up, please tell me if the bleeding is under control now. It's just dripping now. Most caller handlers will do that every shift. We'll try and help control bleeding until the crew arrives. Okay, so based on the information provided, instead of an ambulance response, one of our clinicians is going to call back to give some further advice, so please keep the phone line free. By putting it through to the clinician, they're medically trained and they would be able to advise whether or not the patient can be self-transported to hospital or whether it needs ambulance response and at what level that response would need. The clinician will call you back. They're better placed than us as call handlers to make sure that they're taken to hospital safely if they need to go to hospital, or they can be left at home as well following their triage, which, you know, ultimately means that we do then have crews available for our patients who are bigger sick, for a bit, want of a better term. Okay, and just keep the steady pressure on the wound. Okay, take care. Bye now.
station.
They can be a mixed bag, night shifts. They can be very long shifts. You're out in the dark the whole night. Particularly in winter time, you've got often the pretty rubbish weather to be working in. It's not a very natural time to be up and awake.
4815, you receiving over?
Yeah, go ahead.
Yeah, change of plan. I'm going to divert you onto an amber call in Gordon Street at the Central Mosque. A 17-year-old male intoxicated, not responding. Over.
Yeah, roger, we've got it down now, thanks.
Yeah, say something this time.
Outside, unable to move, sitting on the ground. 5 AM on a Wednesday morning.
It's quite impressive, isn't it? Sounds like he's probably been found by somebody, doesn't it? If he's phoned in like this.
A young man is in distress near the River Clyde. It's a cold night in Glasgow, and down by the river is a dangerous place for anyone to be in trouble.
Not an uncommon call for us, it's something we can see quite regularly.
Don't know if it's worth actually getting into the...
Yeah. Certainly worth swinging round and just... It's just in, so it's not as if it's been in a while. Oh, this is the one that's the bridge.
Mosque, mate. Aye, must be on the main street.
4815.
High control, just to see if we had a updated location for this patient. Just on a drive past and there was no one obvious.
Right, bear with me guys. I'm just having a look now.
That'd be great, thanks very much.
Or maybe even just drive down that wee bit that runs along the water.
You know it's a young person, and from the information you've got, you know they're under the influence. It just becomes a massive sort of welfare concern, really, because, you know, the elements in Glasgow, you know, if someone does go in the water, or even if they just become unresponsive, lie down for even a couple of minutes, you know, but hypothermia is a real risk.
There we go. Yeah.
I feel like this might be the winter now.
All right, pal.
Is it for the boy? Look,
Aye.
I'm sorry about this.
No, he's fine. But where is he?
I don't. He's been running a bit. He's like manic. I don't know if that's the right word. I don't know.
Right.
I'm sorry.
Right. Well, just show us where he is.
I don't know where he is. That's what I'm saying. Like he's running here somewhere.
Yeah, Roger.
Right up. We'll go down and have a wee look.
What side of the water is he at now?
When I last seen him run away, he ran towards
the left,
the
down towards the court.
Yeah.
No worries. This is going to be as good as it gets, eh?
Shall we?
Yeah, because we'll get the motor down that way. When we arrived, we'd found the friend who kind of outlined the kind of situation and the fact that he was quite concerned about his friend's mental state, and then the fact that the friend had kind of ran off. Do you know him? Is he your mate?
He's my best friend.
Aye, best friend. Okay, cool. They'd had alcohol. He may or may not have had some kind of drugs and some substances. And initially, he'd been all right, and then he did quite a big change in his behaviour. He started acting a bit kind of strangely.
I phoned the ambulance because he was lying next to the bus stop. He's acting really mad. It's hell to tell me, yeah.
I'll go and walk up and see if there's anybody at the court, to see if they've got cameras that cover any of that. Because of where we were positioned, we knew the court building was nearby and that they would likely have CCTV that would cover some of the area. I went up to speak to the court building, and Neil continued having a look round down the bottom with a friend.
The water looks still.
So it's just looking to see if there's any ripples, splashes in the water, listening for anybody shouting for help.
So he's been seen on court CCTV running down that way, right out the other side. Right, so they've not got him coming back this way. So we'll probably as well try and run that side and get a look. When we had a kind of quick initial look round, we couldn't see any sign of the friend at all. So at that point we kind of had a bit of a discussion around, we're probably going to need the police here to kind of help us in finding the patient.
Actually, no problem, I'll give it to the call just now, guys, thanks.
Roger, thanks. So, control have also told police, and I assume that's who he's speaking to now.
With no sign of the young man, the crew leave this case to the police.
815, go ahead.
So we've been unable to find the patient, but the police are going to continue to search the area and will ultimately have a research of his address later on. Over.
That's all received, I'll get that noise in the job, mate, thanks.
Thank you. Why is it getting colder as the morning gets later?
Maybe there's snow coming. This is always the bit that kills me as well. This is like I'm just about to drive past my bed. And a little part of me gets quite sad inside.